And apologies to our witnesses for the inconvenience and disruption. Just in terms of, again, I'm looking at clause 1, point 6 of that. It was the Hotels Federation had indicated that hotels should be exempt from mandatory display of a rating because consumers are not aware of what the various ratings mean. And because hotels are already graded in terms of service and structure, a food hygiene rating would confuse, it was suggested, confuse the customer. How would you respond to that?
Quite clearly there is a scheme in place already for the rating of overall quality standards for hotels. We don't believe that introducing a food hygiene rating, which operates on a different basis, is potentially confusing. The hotel grading scheme works on the basis of stars. Now, whenever we were developing the voluntary scheme, what seems like many years ago, one of the main pilots was actually a star-based scheme, and in fact a lot of people still talk about 5 stars as opposed to the 5 rating. That was one of the reasons why we opted to go for a numerical system rather than a star, because there was the potential for confusion. The other thing to bear in mind is that in terms of the sticker that we're talking about, it very clearly states what this is. It is a food hygiene rating. It says it on the sticker. And the fact that it is a number rather than stars, we don't believe that it does create a confusion. And indeed, in engagement that we have had with consumers about the development of the current sticker in the context of hotels, it's not an issue which consumers have raised with us. They find the food hygiene rating sticker does what it says in the tin, that they can understand it.
Okay, so it wasn't picked up through your processes that was an issue in terms of confusion. Okay, clause 2, point 1. Again, it was the Chief Environmental Health Officers Group. They were concerned about the requirement for councils to notify a business of its rating within 14 days, and they would prefer that the 14 days was included in the guidance rather than being part of the legislation. And I'm looking, I suppose, your rationale for including that in the bill.
Yeah. Yes, we have included the details in the bill. The 14 days is a carryover from the voluntary scheme. And the 14 days, I suppose there's a knock-on effect from the time scales here in terms of determining when a rating actually becomes valid. Now, we do totally take on board what Seahog have said, and what they've said is they currently don't have any problems responding within the 14 days, but they want there to be some flexibility. So where there's exceptional circumstances, for example, if they have a big incident in their council and they need to divert officers into other work temporarily, for example, a big food incident or flood situation, they just want some flexibility so that it's not an obsolete requirement on them if they didn't meet the 14 days. And we're confident that we could consider providing an amendment here that would provide that flexibility to them. So when there are exceptional circumstances, it would provide a degree of flexibility to them.
This would actually be consistent with the Food Law Code of Practice, which drives the inspection system, because within that we acknowledge that there can be exceptional circumstances which may require you to do other things than your plant inspections. So there's already a process that we can agree to vary the inspection programme, so to provide the flexibility again for exceptional circumstances seems a reasonable amendment to consider.
Okay, so just so I'm clear, you're York then considering an amendment to that?
Most definitely.
Yeah. Okay, thank you for that clarity. In terms, again, clause 2(3), section G, it was Dr. Hyde, an academic who had carried out some research on foodborne illness, had suggested that this clause should also require businesses to be informed by the councils of the penalties for not displaying the rating or not providing information verbally to customers. Would you have views
Yes, we do. We don't disagree that businesses shouldn't at some stage be informed of penalties for not doing this, but we don't think it needs to sit on the face of the bill. I mean, with all the legislation that the district councils enforce, it's not routine for them when they first write out about a requirement to then, go into the penalties that would apply to that particular issue. What they'll do is, if, as they work through their hierarchy of enforcement, once it gets to the point where they feel that they want to raise the issue and take a more formal enforcement action, they will then be speaking to the operator about penalties and what that means to them. So we don't disagree that businesses shouldn't know the penalties. We just don't think it's necessary for it to be contained specifically here within the list, and it's certainly something businesses the information would be passed to them at the right stage in the process. So rather than bombarding them with lots of information up front, they would get it at the point where it would be more relevant.
In conjunction with that, in advance of a statutory scheme going live, there would be significant promotion of the scheme, and we would be working with the district councils to ensure that the requirements of the scheme and the sanctions were effectively communicated to everybody before we actually go live, so they would understand the consequences of failing to comply with this. And that would be done as a broader package of explaining the statutory scheme and how it's intended to operate.
Okay, but you think it's sufficient that it doesn't need to be on the bill itself or on the face of the bill, that there's enough clarification?
Yeah. To introduce it into the bill would be inconsistent with the approaches throughout the requirements for food hygiene and food safety. None of the other regulations that stipulate what food businesses must do contain this level of detail about communicating the sanctions for committing an offence.
But it's certainly something that would sit within the guidance then. The guidance would sort of flesh out further details.
So it will be in the guidance, okay. Clause 2, section 4 and 5. Again, the Cooperative Food had pointed out that there was no timescales attached for the councils to inform yourselves, the FSA, of a rating, or for the FSA to publish the rating on its own website. It had found from experience that it often takes 2.5 months between being inspected and the rating being uploaded onto the FSA website. And I suppose that means that the FSA website could potentially be displaying an out-of-date rating, which is either detrimental to business, which had improved its rating, or on the other hand given a false impression to consumers where a rating has fallen. So I suppose my question is, have you considered putting a time frame into the bill for councils to inform the FSA of a rating?
We have looked at this. In terms of how the voluntary scheme operates at the moment, councils are required to update their data, in other words, to notify us at a minimum frequency of once every 27 days. That's if they're adhering to the brand standard, how frequently they will be notifying us. In terms then of the publication by us, it in effect is, it happens straight away because of this being an IT approach. When the data is uploaded, it's released into the website. We accept this point, and in order to be able to put a requirement on the FSA to publish, they would have to go hand in hand with a requirement of the local authority to notify us of the rating, so that the two things could work together. Now, again, most councils at the moment do not find difficulty in being able to notify us in accordance with the brand standard. So to ensure that the system does function and the ratings are regularly notified to us and updated in a timely fashion, it would be possible to consider an amendment that would put that into the bill for both the council to notify and for the FSA to publish.
I suppose one of the issues that was coming up for ourselves was, given the fact that many people will actually use the FSA website to check ratings, I suppose, before ordering food or by telephone or even when picking a restaurant. So I suppose, is it not vital from your perspective that, I suppose you lead by example in relation to making sure the website is as up to date as possible?
In terms of us making sure the website is up to date as quickly as possible, that happens at our end automatically once the information is communicated to us. What we need to be mindful of is introducing a frequency of notification to us, which would present a significant burden to the councils if they were to be required to do it more frequently. In terms of how inspections happen, and usually work is planned on a monthly basis and is conducted, reported, entered into their system, etc. There's a logic around allowing what's effectively a 4-week period for them to notify. So there would be significant resource implications in pulling that back to be a shorter period. We also have to bear in mind that at the moment, from the latest research that we have conducted, in Northern Ireland, 91% of people who are using the scheme are actually using the sticker rather than using the website. So the sticker is by far and away the most prevalent way of people informing themselves of the ratings.
But just to be clear, I suppose, is it the case that the Welsh legislation requires the FSA to publish ratings within 7 days
Yes.
of receipt from the council? That is the case?
In the Welsh Act, they have a stipulation for the local authorities to notify within a period of time, and then for the FSA to publish within 7 days of that time.
Okay, that is in the legislation, yeah.
Yes.
Yeah.
Okay, in terms, again, clause 2 as well, part 6. There have been some concerns raised, and you started to touch on it there, about the mandatory stickers. Again, the Hotels Federation believe that the current plastic sticker is not in keeping with the standards of a 4 or 5 star hotel. The Chief Environmental Health Officers Group believe the council should be able to add their own branding to the sticker so that consumers would know who to contact in terms of a complaint, for example. Pubs of Ulster believe that there should be different colours of stickers for different types of food businesses. Have you a response to those views?
I'll maybe just start in reverse order.
Okay.
In terms of the views expressed by Pubs of Ulster around different colours, the important thing to remember is that the information which is of value to the consumer is the rating. It's the number that is important. If you were to introduce different colours for different categories of premises, it would be meaningless and it would be confusing. It wouldn't add anything to informing the consumer. The important thing is one of the views that comes across from industry is that, well, you know, the stickers should look different because not every business needs to do the same thing to get a 5 rating. And that's true. What will need to happen in a small retail outlet that's not handling open high-risk food, the requirements on them, the amount of work and records and so on that they've got to maintain to be able to comply with the law is different from a hotel, which will have to have much more complex systems in place. But at the end of the day, what the rating is showing is that for the business and the nature of it, the activities, etc., this business is complying. So if you have the single sticker, whichever colour it happens to be, with the number 5, the message to the consumer is, whether it's a corner shop, whether it's a restaurant, a hotel, this means the business complies fully and has very good standards. And that is the message which consumers need to get. Consumers make this decision very quickly. We know from our research that the food hygiene rating is only one of a number of factors that we all take into consideration when deciding where we're going to buy food or eat out. And having a different colour, in our view, would definitely lead to confusion and would not add anything to the consumer's decision making.
I would add to that just to say, I mean, does a consumer need to judge what type of establishment they are going into based on the colour of the sticker. They will know they're in a retailer by the fact that it's a retail outlet. We don't feel that having different coloured stickers is really going to add anything to the decision-making process that the food hygiene rating is there to serve.
And what about the issue about knowing who to contact or processing a complaint, for example?
With regard to the point made by the chief officers around them having the ability to have their branding on the stickers, that's something that we would be looking at very carefully when we're consulting on the regulations that will detail the prescribed format of the sticker. We do fully acknowledge that the district councils are key partners in delivery of the scheme, and we understand why they feel that their logo should be able to be there. And there was a valid point made around, well, actually it shows which council's involved, so if you see something you're not happy with, you know which council to go to. We will have to think very carefully about the consequences of that in terms of the cost of maintaining the scheme. We have made some inquiries around costings and the process. The way it works at the moment is that on the voluntary scheme, councils have the option of either using the free stickers provided by the Food Standards Agency, which just have the statement, this scheme is operated in partnership with your local authority, in which case they get the stickers free. If they want to have their logo on it, they pay for those at their own cost. In terms of the cost of providing stickers at the moment, because our stickers are used across now England and Northern Ireland, clearly there are economies of scale, and the cost of providing stickers is minimised through not having logos. The process actually that we use through our current arrangements for printing of stickers cannot cope with logos, so we will have to look at a different approach. But it's something we completely understand the points made by the Chief Officer's representatives, and we will look at when consulting on the regulations about the format of the sticker.
So effectively there you're saying there's really no need in terms of the design or colour issue, that it might confuse, that the issue is about the number and the rating, but that you would be viewing the issue from the Chief Environmental Health Officers?
Yes,
We would be considering that.
when we get to the stage of putting forward our proposals for the prescribed sticker and consulting on those regulations, we will definitely be looking at the issue of the council logo. We do not believe it would be appropriate to consider different colours for different categories of business.
Okay, thank you for that. Kieran, that indicated.
Thanks, Chair, and thanks very much so far for your presentation. I'm going to clause 3, and the pubs of Ulster believe there should be a grace period after assessment to allow businesses to rectify any issues identified, and this should take the place of the appeal. It also believes businesses are reluctant to use the appeals process for fear of being penalised at a later date. How would you respond to these concerns? And have you considered having a grace period rather than an appeals process?
Again, I'll start in reverse order. In relation to the concerns raised by pubs of Ulster about lack of willingness to use the appeals process, we can understand why some people may be reluctant to go down that route. And they may have been less likely to use the appeal route in a voluntary scheme where they didn't have to display the sticker. The fact that it will be a legal requirement to display the sticker would reasonably lead you to believe that if someone feels that the officer has got it wrong and has awarded the wrong rating, that they would be more likely to appeal. We understand, some businesses, they want to work with their environmental health departments. They don't want to fall out with the enforcer. And certainly whenever we're looking at implementation of the scheme, we will consider ways to encourage businesses to avail of those appeals, the appeal process. Turning then to the issue of a period of grace. This is a matter which we believe goes fundamentally right to the heart of the scheme, and that this would not be an appropriate route to go down. If we go back to sort of what we're trying to achieve through the mandatory display, there's the consumer information, but it's also a tool which in effect is deregulatory in nature rather than an additional regulatory burden, in that it lives on the back of the existing inspection system. In other words, the inspections are being done anyway because they're required, so the rating is produced. It encourages and drives self-compliance, self-regulation. If you had a scheme where, in effect, you could wait for the inspector to come out and tell you what was wrong, and then you put it right, there would be absolutely no incentive to comply with the legislation. And we've got to remember that the law requires you, food hygiene law requires you to comply with the legislation at all times. You as a responsible food business operator should be doing your best to comply, and you shouldn't be waiting to be told what is wrong. If you operated on that basis, you've also got to remember that we're using this rating as a likely predictor of future compliance to be able to give consumers confidence. If you ended up giving a rating which was in fact being driven by the officer having gone out and told them what to do, that's no longer a prediction of future compliance, and it would actually make the scheme meaningless, in our view.
Right, so that's a no to that one. But moving on to clause 3, 2, 3 and 10, they're all from Fermanagh District Council, has queried whether this clause would allow a line manager who has not conducted but has signed off on an original rating to be involved in the appeal. Would this be the case, and are you satisfied that councils will have the resources to be able to find suitable people to conduct the appeals?
Yes. With regard to the line manager being involved, the way clause 3.2 is worded, it talks about an officer who was involved in the production of the rating. Now, that would mean that if you signed off the rating, you were involved in its production, so the line manager would not be an appropriate person to deal with the appeal. The appeal is very much about considering matters of fact, and therefore someone above the line manager who may not be intimately familiar with the evidence of the scheme should be able to challenge whether or not the proper process has been followed. And bearing in mind the local government reform, the fact that our councils are now going to be significantly larger, it is perfectly reasonable that there would be someone who was not involved in the production of the rating who would be in a position to consider the evidence and decide whether the right decision was made. It might have been more challenging had we been staying with 26 councils, but this is where 11 councils actually will work in our favour.
Yeah. And what about the resources? Do you reckon that the councils will have suitable resources to find suitable people to conduct any appeals that may need to be taken?
Again, we don't envisage difficulties there, and the reason for coming to that view is that we have been liaising closely with our colleagues in Wales in terms of the experience of having operated the Act there for a year. And whilst there's always a worry that there will be a deluge of appeals and requests for re-rating visits, the experience is that the numbers of these is not massive. Colleagues in Wales, again, the local authorities there have been able to cope with the appeals within the prescribed time limits, which are similar to what we are proposing. It hasn't produced a massive burden on the councils.
Okay. Moving on to clause 3.7, again the Fermanagh District Council suggests removing the text "and insofar as the operator of the establishment permits it to do so." They make the point that if a business has requested an appeal, it should accept that the council needs to take all steps necessary to establish that the rating was correct. Why is this text included in the clause? That's clause 3.7.
Yes. Once a business asks for appeal, we agree with what the councillor is saying, that they may need to do an inspection to consider that appeal, and that's a possibility. We don't, however, think we actually need a right or a power of entry as such in the bill, which is the converse of the wording that's there. If an operator decides not to let somebody to come in to make an assessment for the appeal, then the appeal just doesn't go ahead and they would retain their current valid rating. So there's no need to provide a power as such, because by virtue of the fact that the business has asked for the appeal, then you know they need to let the officer make that decision.
Okay, right. Okay, moving on, clause 310. The Fermanagh again has raised concerns about the possible cost implications for another district council to investigate an appeal, and whether there could be data protection issues. Would there be data protection issues in your opinion here?
I think what they're alluding to there is where we have in the bill that the review process will be reviewed, because at consultation stage some people raised the query about whether the appeal was going to be independent enough, and we've committed in the bill to actually look at that once the scheme has been operating for a period of time. So I think they're sort of thinking ahead to, okay, well, the consequences of that could be that another local authority would look at the appeal. We don't see that there would necessarily be issues with this, and it does currently operate within the voluntary scheme in England, where some local authorities will operate as a peer review, where they don't have independent persons within their own council to do that. So again, that though, however, we would look at the evidence at the point of review, and we would consider the possibilities and consider the options and consult on those with any subordinate regulations.
Oh, yeah.
So if in future we, through the review which we'd be obliged to conduct, we establish that there is an issue with appeals and their independence and who does it and how it's done, clearly we would have to look at all aspects of changing the mechanism, and that would include issues around data sharing and how that would happen.
Right.
But that would be very much at the point of considering options down the line. It's not an issue for the appeals mechanism as proposed in the bill at the moment.
Right, okay. Moving on to clause 4.2. The Chief Environmental Health Officers Group have queried the way in which the term inspection is used in this clause, and state that it has a different meaning than how the term inspection is used in clause 1.1. Can you clarify that position?
Yes, and again, we would consider, or we would anticipate providing further clarity in this in the guidance. This is around a re-rating inspection, and it is different in a sense that it isn't an inspection driven by their programme of inspections that they do under 882. So it's not one of the routine planned inspections they do that falls out of their programme. It's in response to a request for a food business operator to come in and provide them with a re-rating. So in that sense, it isn't an 882 official control inspection. It is a re-rating inspection for the purposes of the bill. But we would certainly provide that clarity, that level of detail would sit then within the guidance.
Right.
It's a duty to inspect rather than an inspection. Earlier in the bill we talk about an inspection, and this is requiring them to inspect to be able to generate the re-rating when requested.
Right, okay. And again, the Environmental Health Officers Group are concerned that the right to a re-rating within 3 months might encourage temporary improvements which would defeat the purpose of the scheme. However, on the other hand, the Cooperative Food believe that businesses should be entitled to a re-rating within 3 months. What is your rationale for suggesting a time period of 3 months?
You're quite right. This has always been one of the really one of the points that has had very divergent views from the stakeholders. So the councils have always preferred the period by which they can do the re-rating to be longer, because they can plan it into their planning better. It gives them a longer time to do that. And they also think that it would mean that businesses really have to commit to maintaining those improvements and showing to the consumer that there'll be a long-term improvement and not a quick fix. The converse of that, as you say, is that the businesses clearly want the re-rating inspection to happen as quickly as possible for obvious reasons. This is an area that we discussed long and hard with all the stakeholders. It used to be, well, it is currently now in the voluntary scheme. The situation is that once an inspection has been carried out, a business can't actually ask for a re-rating inspection until 3 months has passed, and then they can ask for it, and then within 3 months it can be completed. So you're really looking at a maximum period of 6 months in response to the industry's views. And looking at this in the round, the fact that businesses will now pay for the rating and the council will get that resource back in, which will help with their planning, we agreed that that period should be reduced to 3 months, and that is the reason that we have the 3-month period in the bill.
Right, that's right. And finally, the last one on the Chief Environmental and Health Officers Group. They're concerned that there is currently no limit on the number of times a business can request a re-rating and believes this should be limited to once every 6 months. What are your views on this suggestion?
We think this may end up being a possibility because, as is the case with the appeal, we have proposed in the bill that this is an area that should be reviewed once the scheme has been operating. Again, in the consultation, councils did say, we're concerned that a business might ask for lots of re-rating requests, and we really think that they should put their house in order after the one. So we do accept this point, and we have committed to looking at what actually will happen when the scheme is statutory. And at this point we can look to Wales because their scheme has been operating for over a year now. And we've asked them this particular point, are you finding issues where businesses are asking for multiple re-rating inspections? That has not been borne out in the Wales example. So we don't think this may be as much as an issue as the Seahog Group are thinking that it will be. However, we will review it and we will look at it. And if a limit needs to be imposed, then we'll obviously look at options for that, and we'll consult all the stakeholders and take a view on what that should be.
Okay. Moving on to clause 4.5c. The cooperative food believe that there should be a set fee for a re-rating which applies across all council areas. They would like this requirement to be specified in the bill. What are your views on that suggestion?
We entirely agree with the Co-op that it should be a single flat fee, and that was a very strong preference that came out of the consultation. We don't think it should be in the face of the bill. We have provided in the bill that a regulation can be made to specify a single fee. So we already have said that there will be a single fee in Northern Ireland. But once you put it in the bill, it's very difficult to change it because it's primary legislation. And obviously, over time, we might want to go back and review what the fee is and look at what the actual costs are. So that's why it's contained within regulations.
And finally, clause 4.6, the cooperative food believe that businesses should be allowed to apply for a re-rating immediately rather than wait for the 21 days in which an appeal could be made to expire. They state that some businesses will accept that the rating they received was fair and will not want to appeal it, but will want to make improvements as quickly as possible and seek a re-rating. They suggest removing clause 4.6a. What are your views on that suggestion?
Yes. I think, again, I would go back to the point that this whole issue of the time period by which a re-inspection actually happens after the first inspection is an area which has been greatly contended by everybody. And we worked really hard with the stakeholders to agree a compromise, which was that once a business receives its rating, it can appeal within 21 days, and only once the appeal is over then can they then move into the next safeguard procedure, which is asking for the re-rating, and then they get that within 3 months. So looking at the time period as a whole, the councils felt that although they really would have preferred the maximum time period to have stayed at 6 months plus the appeal period, we were reducing that down by half by moving it to 3 months plus the appeal period. So by taking the appeal period out as well as reducing that further again, and I don't think we'd want a situation where somebody may ask for a re-rating and then appeal afterwards. We think this is consequential in the process, and that really the appeal needs to be dealt with first off and then move into the next phase.
Right. Yeah, okay.
There is at times, sometimes businesses can get a little bit confused about appeal and re-rating and what the two things are. Now, if you have a situation where the re-rating can actually happen within the appeal period, you're likely to introduce even more confusion. So in addition to this balance that Catherine's described about an overall period, and the fact that it's sequential is also logical, so that people know at any given time, either I'm in an appeal period or I'm not, or I'm in a period where I can get my re-rating done. And as I say, the key thing from an industry perspective is that this period has been significantly shortened from what we have in the voluntary scheme.
Yeah, okay. Right, Chair, thank you very much. Thank you.
Okay, thank you. Can I just remind members to check their phones as well, because there seems to be interfering with the recording. I have Fergal next.
Moving on to clause 5, and particularly 5.2, and Dr. Hyde's evidence that he makes the point that a council's power to edit representations or to refuse them on send them to the FSA is limited and would be subject potentially to judicial review, and that this should be made clear in the legislation. Have you views on that?
Very technical one again.
The right of reply.
Yeah.
On that very technical view of the issue of right to reply, we have considered that, and we don't believe that that is actually necessary. There were concerns around, well, why would you refuse to publish a right to reply, and is that appropriate? And the main reason why this clause is worded the way it is to make sure that anything which is published by way of a right to reply is accurate and is not slanderous or defamatory. And that's the rationale for it being the way it is. But on the detailed point made by Mr. Hyde, we didn't feel that that was necessary.
with the refusing to send them on to you. Would that not invite judicial review?
It will be, and we think that's okay. That, that's what judicial review is there for. If somebody feels that the due process hasn't been followed, or they have a concern about how that has been applied, I suppose a member of the public or another person can ask for a judicial review.
But would it not make it more robust as a process that those who feel that potentially they have been wronged in any way receive that information through the council to you? Sorry, that you receive that information. And if the councils don't bring that forward, aren't they potentially sealing their own processes, and you don't have sight of them? I mean, you're overall charge of this process.
The difficulty here is that in terms of a right to reply, only the council can make the decision as to whether or not what the food business operator has put forward is an accurate and truthful representation, because only the council is in possession of the full facts. We do not have that information, the detail of every inspection, and we wouldn't want to introduce a requirement of that nature, because that would put an additional burden on both the councils and ourselves. It's also worth reflecting on the fact that the right to reply, whilst there as an additional safeguard for businesses, is not something which is widely used within the voluntary scheme. And we don't see that becoming particularly more prevalent within the statutory scheme. We do depend upon the professional judgment of the councils to be able to decide whether or not a proposed right to reply from a food business operator is an accurate statement, just as we depend on their professional judgment to conduct the inspections.
Yes, but I mean, obviously this. I'm thinking in terms of the right to reply, that this is an assessment now, not just of the food establishment, but how the council is operating, and where an individual council is receiving potentially a disproportionate amount of questions over its process. You do not learn that necessarily if you don't receive those. They refuse to send them to you.
I think it would help if we were able to consider this. We have discussed this with legal counsel, and it's quite technical, and I'm not sure I've entirely got my head around it. But if we were to provide some further written information around this, just to clarify exactly the point that Richard
It's
Hyde's
about how
making.
you would learn about your own system, and if information is not coming back to you, so you would find in one particular geographic area or in one particular range of assessments or tests that in fact there was a constant issue coming back, then you might learn better.
Yes, I think the point Richard Hyde is making is that the councils do have a power to edit the right to replies they get or to refuse to post them on the website at all. And what Richard Hyde's saying is that it should be clear in the legislation that that decision must be reasonable. It must be a reasonable decision, and that the fact that the decision must be reasonable should be placed within the statute to make it clear to the councils that their power to edit or refuse is limited to it being reasonable.
But
I think maybe
who decides? And this is a bit like the policing themselves. You know, it's just you just have to make sure that there's proper scrutiny and oversight.
I think in all cases, the only person who could decide is if it goes to judicial review. It would be it will be the courts who.
Yeah, but that's post fact. I'm talking about how you learn about your own processes. And a robust complaint process which allows flows of information is better than one where information is kept to one side. You wouldn't necessarily know then.
I'm not entirely clear on what it is you think wouldn't flow, because the council would be, if they get information, if a food business decides it wants to make a right of reply and it sends it information, the only circumstances in which it would edit or refuse would be if it was inappropriate for that information to be put onto the FSA's website. They wouldn't be failing to do it. They wouldn't do it just because they didn't want to. If you understand me.
Yeah, but it gives them the power to refuse to send them to the Food Standard Agency in any form.
Yes. If you take the example.
Can you point to me where it says upon which basis they're refusing to send it?
Within 5.2b, you're correct in that it doesn't say the basis on which they should edit.
So they could. You're saying it's a reasonable basis or whatever, but it isn't there.
Yeah.
Whether it comes with clears and guidance or here. Perhaps I'll take it that you will look at it.
Yes, we'll look at it and see if the wording can have some reference to the, the reasonableness of them refusing or, yeah, absolutely.
Okay, thank you. Similarly, the Cooperative Food objects to councils having the power to edit representations, and it doesn't exist in the Welsh legislation. Is that the case?
Sorry, can you ask me that
Yeah,
again?
yeah. It's they're making the same point, but they're arguing that it doesn't exist in the Welsh legislation.
Yeah.
We'd need to check on the
why
exact
the-
wording. There
yeah.
are some differences
Yeah.
in wording.
And there'll be some drafting differences because different people have drafted it, and the bills are structured slightly differently, which will affect the fact that they will look a bit different.
This is an onward point.
So just related to that one, clearly in getting a perspective from the cooperative as a multinational responsible company, they would, before they would send in a right to reply, the chances are to be through their legal department. So they wouldn't themselves see a situation in which you would need to edit it. And that is a reasonable way of thinking for a business of that nature. But if you take a small independent operation who is trying to mislead and deceive and pretend things were not right, clearly there's a rationale for editing being necessary. And also with the aspect of making sure that nothing defamatory is published. So it's very different depending on what type of business you are.
It seems that obviously the outcomes have got to be satisfactory to all, and while that might be satisfactory for your purposes, it's for the business itself on the ground that we have to consider too.
Yeah. If I can just, sorry, I don't want to labour this, but currently in the brand standard guidance, it does provide guidance about when a district council would refuse to edit a right to reply, and we would, obviously want to continue that in the guidance that we produce for the statutory scheme. It's not going to be any different than what it says.
Yeah. An associated point in 5.3 is the point Ballymena Borough Council makes is that there's no deadline set for the FSA to publish representations on its website, Why aren't you setting a time frame?
The reason why we didn't include a time frame is because, as I mentioned earlier, whenever the local authority notifies us, they notify us by way of an electronic file, and the electronic file goes into an IT platform. And for those businesses, once they're outside their appeal period and the rating is therefore valid, they're automatically released onto the website. So it's not as if you've got someone sitting in the Food Standards Agency going, I think I need to upload some data onto the website. The system does it automatically. But in considering the earlier point that was raised about introducing a requirement on the local authorities to notify us within a time period to ensure that you minimise that disjoint between the rating on the door and the website, it would be possible to include a timescale for us, albeit that the current technology we use would mean that it would never be an issue.
Yes, and of course we must all welcome new technology and all the rest of it, but in the absence of that new technology, say there was some issue which meant that the new technology wasn't available for whatever reason, there was a surge or something, and you found yourself in a long-term situation where you didn't have the technology, no timeline, you would then be relying on, now we don't have the new technology, whereas something should be in there of a timely nature.
I think that the timing probably relates more to from when a council gets the right to reply from the business, the time by which they have to let us know of that, because as Michael has said, it's a bit of a moot point about how long it takes us, because it just happens immediately, it happens automatically. That is the upload done. The council has done the upload. It's not really the Food Standards Agency, although it is published on our website. The question then more is really about the timeliness of dealing with the right to reply once you receive it. With that,
it might do it. I mean, is there a red flag on the computer system which says that something is being assessed elsewhere? If that's outside of this, of course, but
no, it literally, really just once the council receives its right to reply, it will go through the process of considering that, and they may actually need to visit the premises to consider it, because somebody may claim that I have completely rebuilt my whole business and done all these wonderful things, and obviously they will need to validate that those claims are actually true and don't mislead people. So they will go about the business of that, and as soon as they've made their determination, it immediately gets published. And as Michael said, in the 27-day uploads, the information just appears with the uploads, and it automatically goes onto the website. There's no pause in time for that part of.
But sorry, is there nothing? I know this has been a bit technical as to the software, but is there nothing under appeal? Does that go up on your website?
It does for appeal, but not for the right to reply.
Right, okay.
Yeah.
Okay. Can I go on to clause 6? And the Chief Environmental Officers Group believe businesses waiting in appeal should be forced to display the rating being appealed, or a sticker advising that the business is awaiting a new rating rather than their previous rating. It's another variation of the Pubs of Ulster view, but it's basically a there's the potential there, isn't there, that this could mislead the customer?
Yes, yes. CHOG's view would be that, let's say, for example, a 5-rated business gets a new inspection, and in fact they feel that the conditions are poorer than before, and they then want to give them a reduced rating. They're concerned that the way the bill's drafted, a business can choose which rating to display in the appeal period only in that 21 days. The existing rating that they have, or the new rating they've just received, and CHOG are concerned that if they have gone down, they will obviously choose to display the better rating. Now that works conversely the other way too. If a business may have an improved rating and they will want to display that, it's important. The 21-day appeal period is a safeguard for the businesses, and they do have that 21-day right to query their rating, and they may feel that the new rating they've been awarded doesn't reflect the standards, and in fact they don't agree that they should go down. So we do see from a business's perspective that it would be detrimental if they then had that appeal and the appeal went in their favour, that for that period, you know, they've maybe had to display a rating which wasn't valid. So we would propose that in the appeal period the business can choose which of the ratings to display, and it's only for a 21-day period, and then at which point the appeal will be determined, and then they will display the rating, the valid rating at that point.
And this 21-day period, in the context of how long a business is going to have a rating, is a very, very short period.
I mean, just to pick up another thing that CHOG said was about a business could instead perhaps display an awaiting
yes,
rating
yes, that's right.
sticker. And, you know, we think we need to think carefully about that, because there's a lot of, if you're going to send out your rating, you don't know if a business is going to appeal. If you don't know if a business may want to put that sticker up over the other sticker the new rating sticker that you've provided. So basically, every time you write out to a business, in effect, you have to provide 2 stickers, one of which may never be used, or one of which will never be used. In many instances. So the other way then, what you could do is, once you know the business has appealed, you could send them out the awaiting inspection sticker, but you've only got a 21-day period anyway. So what benefit is there in such a short period? You know, it works both ways. Either argue the consumer's being misled because the council of the business has gone down, and conversely the business may feel that they don't get to show their good rating where they have gone up.
Okay. In 6.2, this issue around ownership, and Dr. Hyde, who's referred to earlier, has expressed concern. There's a lack of clarity in 6.2 in terms of whether the rating would be valid. Now, this is technical. If the corporate owner of the premises remained the same, but the ownership of the shares of the corporate owner changed hands. And have you given any consideration to these legal technicalities?
Yes, we have asked our legal drafter to consider Richard Hyde's comments, and he is of the view that this is a moot point, really, because we are considering the food business establishment, and if you look at the European legislation, that is a unit of a business. So you're dealing with the conditions in the establishment, irrespective of whether there are share owners or other people. So we feel that it doesn't impact on the bill.
Okay, you may have answered this in your last point, but the Cooperative Foods concerned that a business with a poor rating transfer ownership to avoid displaying a sticker, and recommends therefore that the bill should require district councils to conduct initial inspections of any new food establishments within 14 days of registering the establishment.
If I could just pick up that and actually take it back to clause 1 as well, where I think perhaps there was maybe some concern amongst members about businesses not getting inspected. One point that I would like to make clear is that whenever a new business comes along, and that can be a completely new build from scratch, it can be as simple as a change of food business operator, which in the eyes of the law is the person with responsibility. Through the Food Law Code of Practice, the councils are obliged to conduct an inspection within 28 days for a new business. So every new business that comes along, either a completely new build or a change of owner, will get an inspection that will give them a rating, so that there's always a rating. If the food business operator changes, that leads to a new inspection and a new rating.
Okay. Can you just reflect on what are the arrangements for time periods for providing the rating? Maybe you've answered that. What are the arrangements for time periods for providing a rating for new business or businesses changed ownership? That's happening within.
In that situation, again, it's back to the system of inspection driven by the Food Law Code of Practice. Yeah. And basically, for a new business, then when the council has been notified of a registration or becomes aware of a new business, they're obliged to conduct an inspection within 28 days. 28 days. Irrespective of what type of business it is. A business always must have an inspection, because that first inspection is what sets the system in place for subsequent inspections and interventions and how often they happen.
Okay. So hopefully I've picked up on that point, okay, but there's a reference to 14 days here. in terms of what Cooperative Foods recommend?
Cooperative food, is it? Well, we, as Michael said, there are existing arrangements outside of the food hygiene rating scheme that already deal with how a council will react to when a new business comes along. And as we said, it's detailed that whenever they receive a registration for a new business or become aware of a change of ownership, so with a change of ownership you can't transfer the rating, it's a new business and you're reassessed from scratch again. And in the Food Law Code of Practice that's stipulated as 28 days, and we think that's fair and reasonable, and it gives the council time to plan their work around receiving the registrations. We wouldn't consider that reducing it to 14 days would
If you were to reduce the requirement to do that initial inspection from 28 days to 14 days, that would have to be changed through the Food Law Code of Practice, but that would be of serious concern to the district councils because of the impact that would have on their ability to do their planned work. This 4-week period has been within the regime for many a year from when I was inspecting many moons ago. So this is a period which it's still quite a challenge at times for some councils, depending on the level of business churn you've got. In some areas, you do get a lot of businesses changing hands, so meeting the 28 days can be challenging enough for local authorities. If you were to move that down to 14 days, that would be a serious concern and would have the potential to distract them from delivering their risk-based inspection programme.
Well, just finally, the context in which the Cooperative Food were proposing that was in against somebody with a poor rating transferring ownership to avoid displaying a sticker, and it was around that context.
And that's actually incorrect, because the rating wouldn't transfer once you've a new owner.
Of course, what we give them, what we say,
you get a new rating. So I think that was just a misunderstanding in that. Yeah.
Okay, all right. Thank you very much, Chair.
Thank you, Fergal. Pam?
Thank you, Chair. Just in relation to duty to display rating, which is the clause 7, the Cooperative Food has raised the issue of whether businesses will receive new stickers before the legislation comes into force, in case they've lost their old sticker. Is this the intention of the Food Standards Agency?
Absolutely, that would have to happen in any case, for the very point that they say, because the scheme is currently voluntary. There's nothing to say that a business will actually have its sticker. So we would anticipate that in the implementation period coming up to the scheme, all the businesses would receive their new statutory sticker, if you like. Yeah.
Okay, thank you. And on 7 part 2, Dr. Hyde has raised a technical point, which is that the clause does not seem to prevent a business displaying 2 stickers at the same time, which may confuse the consumer. Have you considered this?
Yes, we've sought clarity again from Council drafting the bill, and the bill is actually drafted that in the appeal period where they can display either sticker, they can only choose to display one of them. They can't display both, so only one will be a valid sticker in that period of time, and by that very nature they are failing to comply with the requirement to display a valid sticker. And so our legal view is that that's actually not an issue. It's covered by the way the bill is currently drafted.
Okay. And members of this committee, including myself, are concerned that the bill doesn't require business to display a rating on their website if they have one. Can you explain your rationale for taking this position?
Yes, we touched on this previously. And again, if we go back to the basis on which we know the scheme is currently used, which, despite the technological era we live in, 91% of people who are using the hygiene rating scheme to make a decision are doing so through the use of the sticker. That's sort of the first point of the sticker, is the way the scheme is being used.
Could that not be because the sticker's there and the rating's not always displayed on? Well, I know some websites do already display them. I've seen that myself.
I'm not suggesting that some people don't use it. I personally use it online as well as on the door, but then you would expect me to say that. Going back to the principle that we have tried to put forward a scheme that is as resource neutral as possible. If you were to introduce a requirement to display a rating on a website, that would have financial consequences for both the food businesses and also for the district councils. To be able to take this forward and ensure, if you had it in as a requirement, you'd have to be able to police it. Now, this would be extremely difficult for district councils to do. It would be extremely time-consuming. It's challenging enough to decide where a sticker should be displayed in a conspicuous place so that it's easily visible from outside the business because of food courts and one thing and another. There would be all kinds of issues around where physically you would display this on a website, on what page it would appear. That would be very, very time-consuming to try and figure out the flexibility around that. To police it, that would distract councils from getting on with doing inspections, which is the important thing for them to do to protect public health. And there's also the fact that in terms of the drive within government more widely, we look to the private sector to make use of information that is gathered by government. So, for example, when you go to the Food Hygiene Rating website, we have an open data source there, which means that any commercial business can lift the current data like that, and it can start to use it to publish ratings. So what we are seeing increasingly as the profile of Food Hygiene Rating Scheme increases is that more and more other companies are taking the information about the rating and they're packaging it with other information that consumers want to make a decision. And the market then is making that rating available for people who are making fundamental decisions about buying online. So, for example, we recently became aware of a website which is operated by a company that is promoting the pub industry. So it will go in and it will lift our open data. And on its website, you will be able to go in, you can select a pub anywhere in the UK, you can find out whether it's got a restaurant, what facilities it's got, whether it's child-friendly, and you will get the food hygiene rating. So the market is actually taking that forward for those businesses where it is something which is more meaningful. We also touched on the aspect of the complexity around multinational companies, the likes of the major supermarkets, and where in fact that transaction takes place, and whether that, when you're using the internet, whether that actually happens within Northern Ireland whenever you go online, which store the food happens to be coming from on a particular day. And I would go back to the point that we made that in those situations, people who are purchasing online for supermarkets, they are comfortable with that particular technology. And for those consumers, if they are concerned about what the Tesco's in the geographical region happen to look like, or the Sainsbury's, whatever, they can quite easily go to the website and see what those ratings are.
I think that's a sort of, I think that's a point to make sort of more generally, is that the bill's trying to fill a gap where there is currently one, and that is where you go to a physical establishment, you have no information on the rating because it's not displayed. If you're online, albeit you might not be on our website and you're purchasing food, the information is available because it's all on our website, which is also online. So it's not as though there's a gap there, it's just not right at the page where you currently are, but the information is potentially a few clicks away or a Google search away. So we think that, you know, the purpose of the bill is to fill a void where there's an actual gap. And for the reasons that Michael's given, there's a lot of cost involved, and it's just weighing up whether it's proportionate for what you get out of it. You could require everybody to have the ratings on their website, but that will pull in a lot of cost and resource from both the businesses and also the councils to enforce. But the information is actually there and collated, and it's searchable, easily searchable through our website. Now, I do entirely take the point you're making, and I think that we can do more to publicise the fact that we have the website so that consumers know when they're online, click onto the website, and it's very easy to search with just the name of the business. So I think there's more that we can do, and whether there's perhaps a requirement in the bill for us to publicise the scheme, to try and build on what Michael has already said is happening, where, for example, you have businesses that, you know, maybe you can phone up and get a takeaway, and you'd never go to the takeaway, you order it through the online service. Some of those sites now have a link on the page directly to our website, so we're working with those providers to get them to understand how to use our open data, so that they can click on a link and it takes them into our website. So there's lots more things that we can do, which we feel from a proportionality point of view and cost is probably a better use of people's time, where we can maybe try and push a lot more with the commercial providers, and they are taking the data and using it quite widely. There's quite a lot of apps on the market now, so people can get the information through their phones and through their tablets. And again, that's something, I don't know, you might want to consider whether there's a requirement on us to do more work around the publicity, so people online know, yes, the ratings is there, it's not like it is absent, but they know to go and look at it.
Well, that's useful. I just think it's a massive hole in this legislation if the rating's not immediately accessible, as it would be if you turned up, you know, physically to any food establishment. You know, you'd expect to be able to see that, and I think because of the massive increase of I'm interested in seeing any statistics, I don't know if you have any, to how much of it is done online, but I know there's one particular pizza outlet, and I know they've actually spoken out and said that I think over half their sales are online. People never go near the shop, so I think it is a gap that needs to be filled in whatever way you do it, and I understand the complications behind that. But as I say, I know there are some establishments already who are volunteering just to put the information up, because I think, especially as you know, as it becomes statutory too, they will probably feel it's a good thing for them to show their good rating anyway.
Yeah.
So I think we'll come to that. But can you just tell me what is the position for this under the Welsh legislation?
Oh, the online aspect, and yes, in the Welsh Act they had a provision to pick this up and consider it within regulations, and they have done a lot of consultation around it.
Yeah.
And where they have got to in terms of requiring the rating to be in other places other than the sticker, the statutory sticker, they have got to a point where they are requiring it to be, if I'm right, on menus. Promotional information. So menus, and it doesn't deal with the website issue. It's dealing more with promotional hard copy material, such as menus and promotional flyers. So that the rating would need, that doesn't actually require that the rating needs to appear on the material, but a statement that says you can find out.
Right.
The rating of this business by going to www.food.gov.uk. They, I think, have unearthed a lot of complications with the website issue, and that is why that hasn't been progressed at this time, and I don't think they've any immediate plans to do so.
Okay.
It certainly was given detailed consideration.
Yeah.
Because you know it's understandable that people would think, well, why wouldn't you just put it on the website?
Yeah.
But for some of the reasons that I've referred to when they've gone into that in detail and had discussions, there was a real appreciation of the complexity of this, and most importantly about, you know, just whether it would be good legislation to have something which would be very difficult to prescribe how it would happen and how it would be policed and the resources that would take. As Catherine said, for those reasons, colleagues in Welsh Government are looking at other routes, but not the website.
Okay, thank you. Just moving on to the duty to provide information about rating at clause 8. That is 8 part 2b. Dr Hyde has suggested that in terms of determining who is the relevant employee, the test should be more objective rather than being left to the opinion of the operator of the business. Fermanagh District Council has also suggested that there needs to be more guidance on what constitutes a relevant employee. What are your views on this?
Picking up from Anna's point first, we agree that they would need further guidance, and obviously that level of detail wouldn't appear on the face of the bill, and we would anticipate providing additional guidance, like Wales have done in theirs, around what a relevant employee means. I mean, I suppose what we're thinking of is somebody that it would be reasonable to expect maybe ask the question. So, and we've particularly put a relevant employee in rather than just anybody, because if you have a very large business like a supermarket and you employ 300 people on any day, it wouldn't really be reasonable for the business to have everybody trained and ready to answer that question. But it would be very applicable to people on the customer services desk, for example, or people serving maybe at the deli counters, where somebody may particularly want to know because you're watching the food handling. But yes, we agree that that would need to appear in guidance. Richard Hyde's point?
Yes, again, we did refer that point to our legal counsel who have been involved in drafting the bill. The view was that in terms of the fact that we have put in relevant employee, that the element of reasonableness is already implied by the clause as currently drafted. And fundamentally, the food business operator has a wider responsibility for ensuring compliance with food law. There's many statutory requirements imposed on them, and to add this one in a similar way seems to be perfectly logical and reasonable, that it shouldn't be any more prescriptively prescribed within a bill.
Okay, thank you.
Thank you, Rosie?
And thanks for the presentation. In relation to clause 10, part 5, the point was made by Dr. Hyde about the Welsh legislation that made it clear that it's not an offence to deface a sticker in the process of removing it, and that consideration should be given to including that in the bill. What way would you view that?
Yes, when somebody would remove a sticker, it would be because they have received a new one. And we didn't really think that it was necessary to actually to actually specify that, whether when it's an offence or not, because I think again that, the council's being reasonable, will not be taking action on somebody for removing their old sticker and putting a new one. So we don't feel that it would particularly add anything above and beyond.
If the sticker's no longer valid, then what happens to it in the process of removing it isn't really relevant, because you just want a sticker that's no longer valid to be removed and disposed of.
Why then did the Welsh put that into their legislation?
Again, I think it just comes down to a drafting point and the drafter's view. And I suppose they were having as perhaps a watertight case as possible that doesn't suggest that you can't remove a sticker, and that in the Act, because an offence in the Wales legislation is that it's an offence to deface to alter or deface the sticker. Well, that will naturally happen when you take it down. And so you don't want to, I suppose, create an offence on somebody doing something that they're required to do to take a non-valid sticker down. But we don't feel that anybody's, going to be taking any action around this point. And although technically it may be correct, it's unnecessary, and that would be the view as well of legal counsel.
So there's no circumstances where somebody might try to remove it and then put it back, say they wanted to clean the windows or something?
Well, if they remove it and they deface it, they can simply phone their council and ask for, or if they damage it accidentally, they can phone the council and get a replacement sticker. We wouldn't see anybody wanting to take action against them.
Clause 10.5 is very much about intentionally altering, defacing, or otherwise tampering with a valid sticker. And clearly, as Catherine said, if something went wrong and something happened through either cleaning or refurbishment work or whatever, that something happened, that the sticker was damaged, clearly the new sticker would be made available by the council. The key thing is that when there is a valid sticker, there is an offence to alter, deface or otherwise tamper. And that's the important thing. What happens to a sticker that is no longer valid? I mean, fundamentally, that cannot legally be displayed, so what happens to it and removing it is really a moot point.
Okay. In relation to 10.7, the maximum fine for the various offences under Clause 10 is a level 3, a maximum of £1,000. Some organisations are not supportive of fines, such as NI Hotels Federation, whereas which supports strict fines to act as a deterrent. What is your rationale for picking a level 3 fine, and do you think it is a sufficient deterrent?
In terms of a level 3 fine, one of the first things that we took into consideration was the level of fine that has been introduced through the legislation in Wales. And there we're looking about proportionality, we're looking at consistency. And the fine has been set at level 3 in Wales. We've also been in discussion with colleagues in Department of Justice, and they have indicated that the level of fine that we have proposed is consistent with similar type offences in Northern Ireland statutes. That said, there's a couple of points that I would flag to you. The first one I previously referred to the committee was that the fines associated with the different levels in England and Wales are in the very near future going to be changed. So a level 1 fine in Wales will become £4,000 in the relatively near future. That's the first point. And at the point in time that we put forward our proposals for the bill, that was not something that was known, so we didn't know that the levels were going to change only in England and Wales. Again, we have consulted Department of Justice in Northern Ireland on that, and there is no proposal at the moment to review the levels of penalty associated with each of the fine levels in Northern Ireland, so that's not happening here. One other point that you may wish to reflect on in relation to this is we have had discussions with our colleagues in the Trading Standards Service around consumers potentially being misled by the use of incorrect ratings other than through an invalid sticker. So this bill deals very much with any offences around someone displaying the wrong sticker. And we were exploring a situation where, say, for example, someone was putting voluntarily their rating onto a website and they were claiming to be a 3 whenever they're a 5. That type of offence would fall within the remit of Trading Standards Service and legislation for which they're responsible. The Protection of Consumers from Unfair Trading Regulations 2008. Now, in the event where someone was found to have breached that legal requirement, the maximum penalty associated with that under those regulations that Trading Standards enforce would be £5,000. Would be a maximum for willfully, intentionally misleading the consumer other than through the sticker. But the rationale that we set out with at the outset was consistency with the level of penalty in Wales, and this being proportionate to similar type offence of failing to display something, being consistent with other statutes in Northern Ireland.
Okay. And just the final question in relation to Clause 12.2. The Chief Environmental Health Officers Group believe that requiring councils to provide new businesses with information within 14 days should not be specified in the bill, but contained in guidance. So why have you decided that the time frame should be specified within the bill?
The timing is specified within the bill to make sure that the system does work fairly and equitably for all food business operators, and that those people who start up a new business, register a new business, will get that information. The key point that the chief officers were making was that this is absolute in its nature, and it says that they've got to provide the information within 14 days of making the registration or receiving the application. The key point being that quite often a council will become aware of a business through a planning application or building control application and will actually be engaging with the business way before it gets round to registering. So they were looking for the flexibility to be able to provide that information at any time when they start to engage. So this is an area where we would be proposing to consider an amendment that would introduce the flexibility to allow the information to be given at any stage before registration and at the outside within 14 days of the registration being received. So we do see the opportunity here to provide additional flexibility to reflect the point that the key point that the chief officers were making here. But we believe it is important to retain the 14 days to ensure that within the bill that we have a fair and equitable scheme that will operate in a sound way for all food businesses.
All right, thank you.
Chair, just
Sure,
one point
yeah.
on 10.5. Couldn't it be in order, though, to add in even just 3 simple words like save for its replacement? Because it would allow for defence in where a replacement was on its way or available. But of course, there would be no defence if there wasn't a replacement process in place. And so it would just make it clear to an employee that they were on instruction, for example, allowed to do it because the employer said, look, there's a new one on its way or it's here or whatever. So you can take that one off.
That's in relation to
10.5.
a valid sticker in 10.5.
Yeah.
In a
You know, you
situation
say
where,
always tampers
where
with a
for
valid sticker, save for its replacement. It might be petty, but
yes.
it's,
Well,
at the end of the
again,
day,
I think if you look at intentionally altering, defacing or otherwise, that very much has the intent in it. If you were taking down a valid sticker because it got dog-eared and the council had given you a new one, you wouldn't be intentionally altering, defacing or tampering. Your motive to take it and replace it with a new one that isn't dog-eared would be sound.
yes, okay, I'll take that point.
Okay. In terms of clause 14, again, it was Fermanagh Council had stated that more clarification was required in terms of how councils are actually expected to keep the operation of the Act under review and just what information they are expected to collect. I suppose, in your view, is that going to place a greater administrative burden on local councils?
No, we don't expect there to be any differences from what the council currently do. So currently with the voluntary scheme, the brand standard, for example, has guidance in there about what the council needs to do, for example, to ensure that they operate the scheme in a consistent manner. So to look and assess that and to assess other things such as determining, for example, the number of appeals and that sort of thing, that sort of information, we already collect that from the councils. So we don't anticipate them doing anything in the statutory scheme that they don't do in a voluntary scheme. And we would also include guidance around that within a guidance document that would accompany this. So we wouldn't anticipate, that level of detail on the face of the bill, but we would put it in guidance.
So effectively the requirements then for councils would be on the guidance?
Yeah.
Okay.
Yes. And again, that would be consistent with the approach in other food law. We will stipulate a general requirement, but where there is a detailed aspect to that and what's actually involved, we will provide guidance on that. And we will always be looking to minimise the burden on councils by way of review. So we will, in discussion with our stakeholder group, which will run for the foreseeable future as this scheme is rolled out, we will discuss with them the way that the guidance should be framed, the kinds of information that would be needed and would be useful to for them to ensure that the scheme's operating fairly and equitably in their area.
Okay, and in terms of 14.3, I mean, the committee had concerns about, particularly, I suppose, the wide-ranging powers contained in clause 14.8, and that was certainly shared by the examiner of statutory rules, who'd actually recommended that clause 14.8 be removed, effectively allowing the department to make amendments to the bill following the FSA review of the Act by subordinate legislation. And the examiner had indicated that this is an inappropriate delegation and sets a dangerous precedent. As an alternative, the examiner had suggested that clause 14.8 could instead include an order-making power to allow the department to alter time limits in the bill. However, this should be subject to draft affirmative procedure rather than negative resolution as envisaged in clause 18.6. So the committee understands that the FSA have taken on those comments and proposes an amendment. That's correct, yeah. So maybe just if you could step us through the proposed amendment on that.
Okay. Okay, so as you say, it is proposed that clause 14.8 is actually omitted, and this would include clause 18.4c and 18.6 because they are consequential based on 14.8. And in place of clause 14.8, there would be much more limited powers then inserted. One of which is, as you mentioned, this examiner of statutory rules touched on, is to provide a power to limit the number of occasions. It's about the time period. There would be a new clause allowing the department to amend time periods specified by substituting a different time period, and as you've mentioned, that would be an affirmative procedure, and also to input the power to limit the number of occasions for a right to request a re-rating to be specifically put into clause 4, because it had been covered in the clause which is now being removed, clause 14.8, that more general power. It was anticipated that would be used to do that.
Okay.
And also then an amendment that will link the review, so the reviews that are detailed in clause 14, that actually now links the review to the FSA actually stating, after having done a review, whether or not they do intend to exercise any of those order-making powers, those draft affirmative order-making powers, and to explain if they are, why, and if they aren't, why not. So they're tied back in to making a declaration at the point when we carry out a review, whether or not we intend to exercise them.
I suppose, is that linked with, I know that one of the suggestions from, again, Dr. Hyde was that particular clause should also specify that the operation of sections 10 and 11 of the Act should be part of the review, particularly whether fixed penalty notices are working. Do you have views on that suggestion?
Yes, there's no specific requirement in 14 currently. As you can see, there is now under the subclause 3, where it details when specific things will be conducted on review. But the reason there is because particular issues were raised at consultation where people felt it was necessary to come back and look at certain things. So we've actually specified those on the face of the bill, the appeal, limiting the re-ratings and time periods. However, the actual requirement to carry out a review is in itself wide-ranging. It just says the Food Standards Agency must review the operation of the Act, so there's nothing to stop us from reviewing anything within the operation of the Act, and making proposals about whether any subsequent changes would need to be taken forward at a later time.
But what specifically about 10 and 11? You know, I hear what you're saying, that there's nothing to stop you, but does it need to be more specific in that regard?
We can certainly consider looking at that, and then whether the order-making powers need to specifically provide provision for any changes that would then need to be made around 10 and 11, because we would have no, certainly don't see an issue with looking at those,
Okay.
and we would anticipate we would actually look at them at review, so we can consider that a bit further.
Okay, and I mean, along a similar line, the Chief Environmental Health Officers Group believe that this clause should specify that the review look at whether businesses are complying with the scheme, whether issues like foodborne illnesses have decreased, what the resource burden of the legislation has been on councils. Do you have views to that?
We would anticipate the review doing all sorts of things. You know, we can look at, well, you know, we will be looking at the compliance levels, and we do that now, and Wales are doing it as part of their review. And we, as part of the voluntary scheme, we've already been looking at the impact on foodborne illness. So that, we don't anticipate that we wouldn't do any of those things, and we'll probably want to do a lot more. We'll want to look at how the appeals process is being used and how many they receive, what businesses actually feel about the appeals process. Do they find it easy to understand? I suppose we don't feel it necessary to have to stipulate every circumstance that the review would cover, because, you know, as the scheme opens up and things come to light, it may not address everything then that a review should actually consider. So it's just to keep it open enough to consider every possibility.
So in essence, the way 14 is currently framed, the power under, well, the requirement on us under 14.2 is review of the operation of this Act throughout Northern Ireland, and that does not preclude anything that needs to be being considered within the review. But in 14.3 we have those things which we know from our experience and from the concerns that have been raised that would definitely need to be looked at to make sure that they are functioning correctly, and the associated powers then to amend those.
Okay. Okay. In terms of 16 then, clause 16, the Chief Environmental Health Officers Group believe that this clause should include a definition of inspection for the purposes of rating and for re-rating. Are there views to that?
Yeah, we've already touched on this, and the CHOG sort of have brought this theme through any, you know, in the other clauses where it's been mentioned, and we entirely agree that, you know, that further clarity would need to be provided in the guidance.
Okay.
Yeah.
Okay. And next, Joanne.
Thank you, Chair. Well, obviously, public awareness is essential, and some stakeholders have stated that there needs to be a public awareness campaign to promote consumer awareness before this legislation is brought in. Can you outline your intention with this regard?
Just to pick up on a point that Catherine raised earlier, and it came up through Pubs of Ulster as well, that at the moment there is no requirement within the bill for the FSA to promote the scheme. That is a requirement within the Welsh legislation, and certainly in terms of that wider requirement on us to take the scheme forward and promote it and ensure that it does what we intend, we would be happy to consider an amendment in relation to that. As regards the timing of the consumer campaign, that would not necessarily happen before the scheme goes live, because we'll have to look and see how the councils want to roll out the statutory scheme. If the councils all decided that they were prepared to put the resources in to go with what we call a big bang approach, then you would have the consumer campaign close to that. But we need to look at timing of the consumer campaign to be appropriate as to when voluntary stickers will be being displayed. But certainly we would fully intend, as we have throughout the life of the voluntary scheme, as recently as this week, where we have a campaign running through social media around Valentine's Day and checking ratings, we would fully intend to make sure that consumers are made aware at the right point in time of whenever the new statutory scheme is going live.
Yeah, because it is imperative that consumers are aware that of this change, and that's why, you know, I would like to outline that sort of time frame. You've said that you will do the amendment, but it's important that we have the time frame of how consumers are aware, because you will obviously have previous experience of promotion and public awareness. I wasn't aware about the Valentine's one. That maybe says more about me than you. And you spoke earlier, Michael, about the responsibility for promoting the law change. You said that, I think you said you would be working with district councils before it goes live, as you said, so the onus will be very much then on the district councils, but how we get to that point before it goes live, as you say?
Because of the flexibility within clause 17, which allows for current, the ratings within the voluntary scheme to in effect be notified and reissued as the ratings under the statutory scheme. There is flexibility there, and we need to sit down with the councils and talk through the implications of how we go about the move from the voluntary to the statutory. The reason being that once you start to issue the statutory ratings, then all your safeguards kick in, so you have to be able to deal with that. What we don't want to do is to go out with a consumer campaign at a point in time where bringing the statutory scheme in has not had an effect in terms of the stickers being displayed.
Okay.
But once we're at a stage where we know the statutory scheme is in effect at the point of wide operation, live from the point of view that you've now got the businesses who need to be displaying issued with their new statutory rating sticker and that being available for them to display, that's when we would put the effort in saying, everybody, you need to know this is now a requirement, and if you don't see the sticker, then this is what you should do about it. So we 100% intend to do it. We've just got to get the timing right relative to the implementation of the scheme. The big thing before the scheme goes live is promoting it with the businesses and working, the council's working with them to help businesses which currently don't have a top rating to get to a better position. So a lot of the effort before go live day is with getting the businesses and making them aware of what their obligations are, what they've got to do, what they can't do with stickers, the obligation to verbally notify, etc. So we do all that in advance of the go live. And then once we have, in effect, got it happening out there in the businesses, that's when we get the message out to consumers.
The timing's crucial with that one.
The timing is crucial.
If I can just give Wales as an example in terms of timing, as Michael has said, there will need to be a transitional period to allow the councils and the businesses to migrate from the voluntary over to the statutory scheme, because those ratings need to be reissued for 15,000 businesses in Northern Ireland. In Wales, it was agreed through the consultation when they started to look at what the transitional period would be, that should be set at 18 months, and that was agreed with their stakeholders, their businesses and their councils. And we would obviously want to do something similar here. We get a sense from the councils here that they may want to try and bring in a statutory scheme as quickly as possible, provided their resources allow them to do that. And it may be that the transitional period in Northern Ireland could be shorter, it could be 12 months, but we really don't know until we go out and speak to them about what they can actually achieve. So, as Michael has said, based around what the transitional period would then be, it would be critical once the transitional period is over, that then you would have your consumer campaign, because at that stage, every business in scope of the scheme will have been given their new statutory rating.
Okay, so it need to happen very quickly after that then?
Yeah.
Okay, sanctions for councils. I note that the Cooperative Food believes the bill should contain sanctions for councils who do not meet timeframes laid out in the bill. What's your views on this suggestion?
Again, this is a matter where we have sought legal advice, and it is not established or normal or good practice for legislation made by one government department to, in effect, have sanctions against another government arm of government. The key thing is that at any stage, if any person feels aggrieved that any arm of government, be it Food Standards Agency, district councils or whatever, have failed in their obligation, then there is the remedy of judicial review by which they can seek to be recompensed for the damage they believe they have suffered in relation to a body not fulfilling its obligation. So the fact that this isn't in this food hygiene bill, rating bill, is totally consistent with other legislation, and it would not be practice to put that in for an offence to be committed by another department.
It's not in the Welsh bill then? Okay, that's good. Thank you. Thanks, Chair.
Thank you, Joanne. Well, thank you. Sorry, Kieran.
Yeah, very briefly, Chair. Michael, during your answers to some of us, you said, and I think it was referring to if something went wrong, there would be a notice somewhere to report it to your local authority. Now, when you said that, I said, to myself, should that not be reported to your local council? Because, people maybe say, everybody doesn't know what their local authority is. It could be their health authority, it could be their, rather than local council. Is that written down somewhere?
At the moment, our sticker refers to in partnership with local authority. That's the way we tend to refer across the UK. I accept the point that in Northern Ireland, local authorities are de facto district councils. We would always be careful in external communications that whenever we're communicating what should happen and where you should go, we will talk about district councils rather than local authorities, because we know that the average consumer or member of the population in Northern Ireland thinks about district councils, not necessarily about local authorities.
That's right.
It's something we're aware of. Because we work as a UK organisation, I have a tendency at time to talk about local authorities in a wider sense, so I apologise for that.
Yeah, no, I'm only saying, I mean, if somebody wants to report whatever's wrong, they might look at their local authority, it could be their local health, and they're all around the house before they get to where they want to should be.
You will say district councils.
No, that's grand, that's fine. Thanks, Chair.
Okay, Kieran, thank you. Well, thank you both. That's been it's been useful in terms of clarity for us, and obviously we'll reflect on the evidence today. Thank you both. Thank you. Okay, members, just advising next steps. On the 25th of February, the committee will discuss and obviously consider the responses received today in order to inform us how best we take forward the bill. As per the usual practice, I'm seeking agreement to do this in closed session. Are members agreed with that? Okay, and I'm going to move on with the business and leave the presentation from the officials to the end, just for in the interest of time. So item 6 is the Health and Personal Social Services General Medical Services Contract Amendment, page 40 of your meeting pack for the relevant papers. Just reminding members again that the committee considered and approved the SL1 for this rule at our meeting on the 1st of October 2014. There have been no changes to policy content since the SL1 was submitted, although the Examiner of Statutory Rules has yet to report on the SR. Are members content with the statutory rule? If so, then the Committee for Health, Social Services and Public Safety has considered SR 2015 number 26, the Health and Personal Social Services General Medical Services Contract Amendment Regulations 2015. There is no objection to the rule, subject to the report of the Examiner of Statutory Rules. Item 7 is an SR 2015-27. It's the provision of health services to persons not ordinarily resident regulations. Members will be mindful that we had dialogue and discussion previously on this. The page 52 of your meeting pack is where the relevant papers are. Again, the committee considered and approved the SL1 for our rule on our meeting on the 1st of October 2014. There have been no changes to policy content since the SL1 was submitted, although the Examiner of Statutory Rules has yet to report on the SR. Are members content with the statutory rule? Therefore, the Committee for Health, Social Services and Public Safety has considered SR 2015 number 27, the provision of health services to persons not ordinarily resident regulations, and has no objection to the rule, subject to the report of the Examiner of Statutory Rules. Item 8 is an SL1, the Health and Personal Social Services Superannuation Health and Social Care Pension Scheme Amendment Regulations. It's on page 78 of the meeting pack. Are members content that the Department makes the rule?
Great.
Item 9 is an SL1, the Misuse of Drugs Amendment Regulations. It's page 89 of your meeting pack. Are members content that the Department makes the rule?
Great.
And item 10 is the Misuse of Drugs Designation Amendment Order 2015, page 97 of the meeting pack for the relevant papers. Are members content that the Department makes the rule?
Great.
Item 11, members, is the Forward Work Programme. I'm just asking members to note that. 12, Matters Arising. There are 10 items under Matters Arising. Again, in the interest of time, just want to draw your attention to several of them. 12.1 on page 107 is a response from the Minister regarding the benefits management framework for transforming your care. The committee had forwarded the report of our expert advisor Anne Watts to the department for comment. The department has accepted many of the expert suggestions and is working to update the framework accordingly. I think, members, this is a good example of the committee undertaking a piece of work which has not only scrutinised the department but has also assisted them in revising and improving their approach. So I think it's been a useful exchange. I think there are some areas where maybe the department could provide more detail, and I'm suggesting, members, that the clerk prepares a paper for consideration at next week's meeting.
Great, yeah.
Item 12.5 on page 121 is a response from the Minister regarding the adoption legislation. He advises that he's going to write to the Executive to seek agreement to go out to public consultation on the draft Adoption and Children Bill. I'm seeking agreement, members, to write back to the Department to ask the Minister when he intends to write to the Executive on the matter. And I'm seeking agreement also to forward the response to Adoption UK.
Great.
13 is correspondence. There are 10 items under correspondence. Again, I just want to draw attention to several of them. Page 166 is correspondence from OFM-DFM. Committee seeking details of the committee's involvement in European issues last year and our approach to European issues looking ahead. Just referring members to the draft response prepared by the clerk, which is tabled.
Yep.
And if members are content with that. Item 14 is any other business.
Yeah, Chair, I have one. There's a lot of concern. This is about the Independent Living Fund. A lot of concern out there. It's coming to a close on the 30th of June, and nobody knows what's going to happen. Would it be in order that we could invite oral evidence from the officials to the committee to tell us the outcome of the consultation, which ended on the 30th of November? And we have only a few months left until this has disappeared. People do not know how they're going to cater for their severely disabled members of the family.
Yeah, well, I mean, I have no issue with that at all. We should certainly be seeking an update from the department with a view to them coming in to present as to the consultation process and next steps.
And that's right. I mean, we're doing the same, I think, in this next presentation. These people are coming in to give us a presentation on the consultation that they were involved in, as I understand. There's no reason why we couldn't, and hopefully that would encourage the department to let people know what the future holds for the families of people with learning disabilities.
Okay, and can we agree then that we will write to the department in the first instance for an update with a view to inviting them in on the issue? Okay?
Okay, thanks. Thank you.
Okay, members, then moving back to the departmental briefing, which is item 5. It's the secondary uses of patient information legislation, page 23 of your meeting pack. Okay, folks, you're very welcome. We have Ms. Sharon Gallagher, Director of Corporate Services at the Department, Mr. Chris Matthews, Head of Information Management Branch at the Department, and Professor Roy McClellan, Chairman of the NIE Privacy Advisory Committee. And I understand, is it Roy, that you are on a tight timescale? You have to leave at 5. So
I'm at your mercy, ma'am.
Okay, okay. So can I just invite yourselves to make the presentation, and we'll open it up to members.
Of course, thank you, Madam Chair. So good afternoon, Madam Chair and members. Thank you for the opportunity to update you about the Department's response to the public consultation on proposals to bring forward legislation which would enable personal information of health and social care patients to be used for purposes other than their direct care in limited and controlled circumstances. We previously gave evidence to the committee during the public consultation period when we outlined the benefits of the legislation. We also set out the circumstances under which the use of patient identifiable information would be considered. which are when it can be proved that the results could not be achieved without access to the data sought, that it's not possible to secure consent, or that anonymised and pseudonymised information could not provide the same outcome. Just to briefly recap on the information provided previously, currently the HSE may share patients' information for non-direct care purposes if consent has been given. Where consent is not possible, new arrangements have been put in place to allow for the sharing of information where the patient's identity has been anonymised or pseudonymised. However, even when these developments, there are instances where access to identifiable patient information is needed to secure the required outcome. Under current arrangements, patient identifiable information may already be used for purposes other than direct care, as long as the requirements set out under the Human Rights Act, the Data Protection Act and the common law duty of confidentiality are met. The requirements of the Human Rights and Data Protection Acts are clearly defined. The common law duty of confidentiality is less clear. Under the common law duty of confidentiality, where consent has not been given, personal information may only be shared if there is a statutory basis for doing so, or if disclosure is deemed to be in the public interest. The ambiguity about what constitutes public interest means that decisions may be more subjective and prone to legal challenge. This is where the proposed legislation will come into play, in that it will provide a robust and transparent legal basis for decisions taken in sharing patient-identifiable data for secondary uses. The Department's public consultation on the proposals commenced on the 7th of July 2014 and closed 14 weeks later on the 10th of October. Over 500 individual letters were issued inviting comments, and the Department's consultation report was published on its website. A copy was sent to the committee on the 3rd of February. 59 responses were received, 47 from organisations and 12 from individuals. The respondees came from a wide variety of backgrounds: statutory, medical, social care, legal, voluntary and charity. There was overwhelming agreement, with 94% of respondents indicating their agreement with the proposals. The remainder did not specify whether they agreed or not. In addition to this public consultation process, we also engaged directly with a number of key stakeholders, including Disability Action, the Northern Ireland Human Rights Commission, the Northern Ireland Law Centre, the Patient and Client Council, the VMA and the Information Commissioner's Office. As I previously advised the committee, safeguards will be a key element of the changes, with robust controls and protections in place. Given the importance of the safeguards and the structures which will be put in place to deliver and support these, the detail of these will be contained in the regulations. These regulations will be subject to committee scrutiny and public consultation. It's important to emphasise again to the committee that in the majority of cases, information that does not identify the patient will be sufficient to deliver the required outcomes. I would also reiterate that it will remain the Department's policy that primarily an individual's consent will be obtained for the use of their information. In conclusion, in light of the overwhelming support for the legislation and no compelling case for further amendment, the Department has commenced the legislative process and proposes to introduce the bill to the Assembly in March or April 2015. I hope that was helpful, and I'm happy to take any questions.
Thank you for that. Just in terms of the documentation that we've had, there's obviously a clear commitment that confidential information, and you've touched on some of it, would be used only for medical purposes. And then it talks about purposes linked or intended to improve the social well-being of the community. And there's an explicit commitment that insurance companies and other commercial interests wouldn't get access.
That's right.
So I suppose, firstly, you know, the definition of social well-being can be very broad. Maybe you could just give us a sense of how that's defined.
Perhaps, Rory, would you like to pick that up?
Happy to take this up. I think the whole ethos of what we're trying to address is the necessary sharing of health and social care information within the health and social care family for uses that are essential to the health service. We have an integrated health and social care service unlike England, and therefore the kinds of arrangements that they have sought to seek remedies for are purely for health And my understanding is that the framing of this in terms of medical and social care information is to recognise the integrated nature of health and social care in Northern Ireland. And certainly from the experience of the Privacy Advisory Committee, there are a range of circumstances where, in order to improve the quality of patient care, you do need access to patient information, whether it's medical or social. And while, in our experience, with improved facilities for anonymisation, there still remain a range of situations, both on health and social care side, where it is not possible to get consent and where anonymised information isn't able to do the work. It's in these exceptional situations that we have evaluated as a committee, researched it as a committee, and support the proposals that the Department are bringing forward at this time for a very tightly regulated arrangement that would allow, in exceptional circumstances, under proper scrutiny, either health or social care information that is identifiable to be exceptionally shared with identified others.
But so there is like a definition or a range of criteria that would be defined as social well-being?
I do think that that benefits from clarification, but
Okay.
it is the stuff of health and social care services. It's at the heart of what is.
Yeah, I absolutely understand that, but I suppose the definition of social well-being can be many things to many people.
Indeed. If I could pick that up, Chair, I think absolutely agree. Social wellbeing is a very broad term, broad in definition and interpretation. Certainly for the next phase in terms of the regulations, we would want to look at that a little bit further. This is meant to be a very restrictive, very controlled provision. Purely for medical reasons and for the health and well-being probably of the people of Northern Ireland. So that's certainly consideration moving forward.
So it's something that you intend to
absolutely
give
be
consideration to in terms of moving forward?
Indeed.
Okay, Fergal, it's on this, yeah.
Yeah, just obviously there'd be processes after you'd introduced the legislation, but you're talking about a very swift timetable for introduction, yet that core issue is not resolved. How do you get around that?
Well, if I can speak, the definition in terms of social care will be the standard definition of what social care provision already is within the social care regulations. So the social care, the specifics off the top of my head, I don't recall, but it is what is already defined as what social care would be within social care regulations. So we're not seeking to redefine social care. What we're seeking to say is that it would be the definition of what social care currently is within existing regulations, and that's what we would follow through with.
But I think the issue is that it's social well-being, which is not social care.
Absolutely accept that point. I think where we're coming from is the definition of health and social care. That's primarily what this is about, the link to health and social care, not social wellbeing, which can be interpreted very, very differently. In drafting the bill, we'll certainly consider that language very closely to make sure that the purpose and the bill in itself is very restricted in relation to what we mean by that.
Because I think it's an important issue in terms of access to patient data.
Yes.
That somebody's definition of social care may be very, very different from somebody else, and a case may be made.
Yes.
And if we don't have it very, very clear and pinned down,
yes.
It's potentially a gap, I would have thought.
Absolutely take your point, Chair, and we're working in the drafting of the bill at the minute and working with solicitors in that regard, and we look at that definition to make sure it's absolutely tight, because it's not the Department's intention to leave this broad or open to interpretation. We want to keep it very narrow and keep it restricted to medical and to health and social care purposes.
Okay. Well, can you share that information with the committee in terms of that clear definition?
Happy to do so.
Okay, and there was another issue there just in relation to, again, it was the consultation paper mentioned winter fuel payments, but I'm not sure if that includes areas like welfare benefit fraud investigation or
No, that
security
particular instance was when OFM DFM had agreed a payment for cancer patients, an extra payment, which was obviously coming through health and social care. And the difficulty at the time was being able to identify the individuals who would be entitled to the payment, because we weren't able to use their information for that secondary purpose. And in that instance, the solution turned out to be that the information was provided to, or the general practitioners actually administered the service and linked in with the Business Services Organisation. So it just became quite a convoluted process of trying to identify those who were entitled. And there was some concern at the time in the planning that there would have been, the payment could have been made more quickly had we been able to use the existing obviously the regulations under the bill to be able to actually get access to that information and write out to those people asking them did they wish to submit the application.
So it was very specific to that process
specific
around
to
fuel
that.
payments?
Yeah, for that particular instance, yeah.
Okay, it wasn't including other areas then, like welfare
No,
benefits?
no. It was
Wasn't.
very specific for that one-off payment.
Okay, and then, and I think, Sharon, you had touched on this as well, but in terms of other commercial interests, I'm thinking specifically around insurance companies and other interests, will not get access. Is that effectively what we're saying? Does that then include private medical and social care providers or pharmaceutical companies?
In terms of selling information or selling data, absolutely.
It does
Yes,
include,
indeed.
it does include, okay. Okay, folks, Kieran had indicated.
Yeah, just very briefly, will this legislation also govern the use of data which is collected outside the health service but can be captured and analysed to help with health outcomes?
It's not intended. It's intended to, if there is a service provider who provides services for the health and social care sector under contract to the health and social care sector, then it could include that information. But we wouldn't intend making it where we would say that a private company has to share its information. No.
Right, okay. That's fair enough, Chair.
Okay, no other members had indicated. Thank you.
Yeah.
We have run you out on time. We certainly would be seeking that clarification around the definition
Happy to
of
do so.
social wellbeing and look forward to that response.
Happy to
Thank
do
you
so.
for your time today.
Thank you.
Okay, members, finally, it's date and time for next meeting, which is Wednesday the 18th of February, starting at 2 o'clock in the Senate.
This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room